Department of Health Informatics and Information Management here at the College of St. Scholastica. And on behalf of the department and the college, we just want to welcome you. This forum did start as a way to welcome healthcare leaders to the college to share their insights and experiences regarding the paths that have led us to where we are today as a profession, as a college, and a community. And just to begin, I would like to welcome President MacDonell to the podium, the virtual podium, just to welcome all of you today to the forum. President MacDonell?
Well, thank you very much, David. I really appreciate the opportunity just to say hello to everyone. I'm here just at the beginning to do that and welcome you all to the LaTour Eichenwald Forum this year. And I'm just so excited about the speaker, Jean MacDonell. I've known her for some time. Our paths crossed when I lived in Grand Rapids, Minnesota, and served on the Grand Itasca board of directors. And so it's just tremendous to have you here, Jean, today and to share your wisdom and story with this group. I can't think of a better speaker, so I'm really delighted to have you here. So welcome as well to the forum this evening. I hope everybody has a wonderful experience this evening. Our value of the year is love of learning. And so what a perfect match for this particular event tonight. So it's great to see everyone, and I hope you have a wonderful evening and discussion tonight. Thanks very much, David.
Thank you. Well, thank you, President MacDonell. So I just want to begin by sharing with you some information about the forum. Kathy LaTour and Shirley Eichenwald Mackey, they spent their careers at the College of St. Scholastica advancing the profession of health information management through education, professional leadership, research, and collaboration. They took health information management to the next level, and they're recognized pioneers for their contribution. To highlight some of their notable achievements, they developed the first accredited Master of Science program in health information management in the country. They wrote the textbook on health information management, with now the 6th edition, which was recently released and now co-edited by our faculty members Pamela Oakes and Amy Waters, and they ultimately developed the Health Information Management Department at the College of St. Scholastica as the most recognized and respected in the profession. And after all that, they both retired in 2012. In honor of their pioneering spirit, the college has established the LaTour Eichenwald Forum on Health Informatics and Information Management Leadership and Innovation. Our guests today embody those leadership qualities and innovative approaches that Kathy LaTour and Shirley Eichenwald Mackey have always demonstrated. I would like to take this time to personally recognize Kathy LaTour. And I believe Kathy said she might be a few minutes late to this meeting. She had a conflicting meeting, so she might be just a couple minutes late. I don't know if she's on here quite yet, but if she is, maybe do a virtual wave, Kathy. I haven't gone through the videos here to see if you're here. So a virtual wave.
I'm here, David.
All right, nice seeing you. As we celebrate Kathy and Shirley's achievements, we also want to reflect on the wonderful life lived by Shirley. Shirley passed away in April of 2019, and this forum is one way for us to celebrate the great life that Shirley lived and all of her contributions. To commemorate Shirley, we had a special memorial made in remembrance. If you go to the CSS campus and in our department, in our department suite, you'll find a plaque that we proudly display on the first floor of science. And the plaque reads, "The Department of Health Informatics and Information Management, Shirley Eichenwald Mackey, in loving memory of our leader, teacher, mentor, and friend, 1945 to 2019. I'd like to just take a moment of silence in remembrance of Shirley Eichenwald Mackey and all that she has contributed to the profession and our lives." Thank you. Today, I am very happy to welcome Jean MacDonell back to the College of St. Scholastica to share her thoughts and experiences on rising to the challenge of rural healthcare leadership. Today, we're going to format the forum where we will hear remarks from our wonderful speaker with time for questions at the end to engage our guests and meaningful discussion on the topic. We will keep all of the microphones muted until the end of the presentation. And then at that time, you can unmute to ask your questions, or if you'd like, you can type your questions into the chat window, and myself or Eric Nordgren will then present those questions to our speaker. Jean MacDonell has been the president and CEO at the Grand Itasca Clinic and Hospital in Grand Rapids, Minnesota since 2019, and became the president and CEO of Fairview Range in Hibbing, Minnesota in June of 2021. Jean has 23 years of experience in healthcare, 14 of which have been at Grand Itasca. She graduated from Grand Rapids High School, attended the College of St. Scholastica for her Bachelor of Science in Health Information Management, and received her Master of Business Administration from the University of St. Thomas. Jean has been an incredible advocate for the health informatics and information management profession and a very active community member. Jean has been an incredibly active member of the Minnesota Health Information Management Association, even serving as the president in 2014. She has also served as a mentor for our professional practice experience for undergraduate health informatics and information management students during their internships. And for many years, she served on our Health Informatics and Information Management Advisory Committee. Not only that, but she has been involved with the Itasca County Family YMCA, the Grand Rapids Area Library, the Grand Rapids Chamber of Commerce, and a number of other community organizations. Needless to say, Jean has been an incredible leader, and we are very happy to have her speak with us today. Let's extend a warm welcome to Jean. Jean, I'll hand it over to you.
All right. Thank you, David, and thank you, President MacDonald. I'm just so thrilled to be here. I'd like to welcome everybody as well, and just thanks for dialing into the event. I wish we could be in person at the college. And as David said, I'm Jean MacDonell. I probably know many of you, but I'm the president and CEO at Grand Itasca in Grand Rapids and also Fairview Range in Hibbing, and a proud HIM graduate of the College of St. Scholastica, and really just honored to be the keynote speaker this year for this forum. It was certainly humbling for me to be asked to speak today, and I really had a reflective walk down memory lane as I prepared my remarks. So I hope that my story is interesting to you. It's hard to talk about yourself sometimes, but my career journey, I think, has been fun, and I hope you enjoy it. As David said, I've been in healthcare for 23 years now, and it's hard to say that. I feel like I just left the college. And I thought I would just talk to you today about my journey and some of the experiences that have shaped me as a leader and led me back here to rural Minnesota. So as we get going through the presentation here, I can't talk about my career without starting at the beginning. In the halls of St. Scholastica, I started my undergrad years as a nursing major because that's what my dad told me I needed to do. And I really wanted to be a teacher all of my life growing up. But my dad really put me on a different path. He started out as a teacher and he told me they just don't make enough money. So I need to go into nursing. And I started to frantically, look around and decided to follow his lead. And I decided when I was about a junior that was not going to be an option for me. I just did not want to be a nurse. And I started to dig around the college and discovered the HIM department. Had never heard of it before. And after a couple meetings with Kathy, I was sold on HIM as my major. She really helped me figure out a plan to get me started in the program. And even though I was a fifth year senior when I graduated, I feel so fortunate to have found this group of awesome people, and just, again, really proud to be associated with the college and the HIM program. I started that next summer in the progression program and had to catch up with my classmates. And then I went into the traditional program that next fall. And I could still remember sitting down with my parents, explaining to them at the kitchen table that I was changing my major and that, yes, there was a major focused on medical records. So I had to put this picture in. It's just a shot of my senior HIM class of 98. And sometimes I do wonder if Kathy regrets my acceptance into the program, since my class really did become a cautionary tale for future classes on how not to behave at the national convention. Somehow I was nominated to represent the class when we got back to talk to Kathy and apologize for our group. And I hope people are chuckling at this. I'm able to chuckle about it now. It's hard to tell over the Zoom, but it is a true story. And I wanted to just start out talking about my journey with some stories about Stanford, which is where I took my first job out of college. And I did my 3-week professional practice experience there in the winter of 1998. And that was quite the experience for me. I chose Stanford because I have an aunt who lives in the area, and I thought it would be fun to get out of Minnesota. And the picture at the top of the slide is of myself and Mary Ware on my last day of employment there in 2005. Mary was one of the first leaders I interacted with at Stanford, and she taught me a lot. First and foremost, how sheltered I was in northern Minnesota. Mary was the first African-American person that I ever met and knew. And over the years, I've really thought a lot about many of the things that I learned from her. I can remember her showing me the masturbation index on my second day, and she asked me to type in a common last name, and we'll look it up. And I naively typed in Anderson, and she looked at me and said, "Where are you from? Let's type in Ramirez." And I was like, "Oh, of course, of course." And so I just, realized I was not in northern Minnesota anymore. And not only the HIM department, but all of Stanford, of course, was so diverse and full of new experiences for me that really helped to shape me. The HIM leadership team is in the second picture here, and I'm not sure what's going on with my hair there, but we don't need to focus on that. On my last day of the internship, the HIM director took me out to lunch and offered me a job. He was not an RHIA, and the state statute in California at the time required that the head of HIM be an RHIA. So he was really looking for credentialed individuals. And he also said, "I just know people from the Midwest are hard workers." And I was so excited about the opportunity. Of course, I stayed up late at night thinking about how I was going to step into a leadership role right out of college and be effective. And on my first day, I was meeting my staff, and I was terrified that one of them was over 60 and had been in the department for 30 years. And I decided right there I had to start with her and asked her to teach me everything she knew about the department and what she did every day. And I really got to know each employee and listened to their ideas and thought about how we could make things better. After a couple of years in that role, I moved into transcription and then into a manager position over both of those departments. And this guy here is Rod Madamba. He was one of my favorite coworkers in California at Stanford. Rod was my first true colleague and work friend, and early on in my career, Rod pulled me aside and told me he's never worked with anyone so willing to just do anything that was needed, including an offer to babysit his kids while he was working constantly through a system upgrade. And I started to realize there that, the way you are and again, the relationships that you find and foster really do create the environment that you work in, helps to build trust, and eventually will turn into positivity and eventually, opportunities at work and for your career. So I started to think, if I can excel at the basics while I'm the youngest person in the room, I can gain credibility, and I focused on just answering calls, being available, listening, being present, helping people with the computer, the basics. And in my time there, I also learned how to take some criticism and be manageable, the art of reflecting and how to manage up. I really found a way to, in my years there at Stanford, I started to find a kind of a humble confidence and learn to embrace my leadership style, which wasn't easy. My boss at the time labeled me as a cream puff, and I still remember this. I can remember the exact moment when I went from being pretty self-conscious about my leadership style to feeling good about it. We were working through a leadership improvement project around employee evaluations. And we actually had a consultant come in and pulled all of our evaluations for 3 years. And they plan to give us recommendations on how we can give meaningful feedback to staff at evaluation time. And the evals were rated from 1 to 5 overall. So my colleagues were already poking fun at me, the cream puff, saying I was too nice and my average numbers are probably 4.9. And I just felt so vindicated when the consultant gave us the results and my average scores were the lowest. So my colleagues were like, what? How's that possible? And this is where I first heard the phrase iron fist, velvet glove. And although I don't love that phrase, it always reminds me of that moment and reminds me, be kind, be fair, be honest, be transparent, and people will follow you and accept your feedback. A few years later in Grand Rapids, I had a similar experience when my boss asked me, how would you get this doctor to get on board with this change? And I said, I would kill him with kindness. And he said, that is never going to work. And that night at home, I was like, oh, that was such a dumb answer. I should have come up with something smarter. But later that year, we were working through lessons learned after the project, which was an epic go live. And that surgeon told our administrator, you guys were genius to put Jean in that project management role for this horrible computer system. I hate this change and I miss my paper charts, but I could not get mad at her because she was too nice to us. And so again, I just kind of felt like, okay, I can use my personality and my style to get things done and to lead people in a meaningful way. So before I leave California in my story, I just wanted to touch on another mentor of mine from that time period, and her name was Kit Leong. She was the director of HIM at the Children's Hospital that was attached to Stanford and really taught me the importance of getting involved in local and state associations. So I was involved in those out in California and just networking and how easy it was for HIMers to branch out into other areas. And when I left Stanford, Kit was in the quality department and I had moved into IT, working as a business analyst on a Cerner implementation. Another great experience. And I'm sorry, I could only find this terrible blurry picture of Kit, but I wanted to throw her in there anyways. And I don't know if you guys are noticing a theme with my outfits here, but these are obviously all taken on the same day from my going away party at Stanford. So many of you will recognize this fine lady, Elaine Yagi. I worked for Elaine during my time at St. Scholastica doing release of information for her copy service. And what a hardworking lady and all around gem. I worked in California for 7 or 8 years. And for the last 5 of those years, Elaine kept in very close contact with me. I'm highlighting her because without her persistence, I don't know if I ever would have made the big move back to Minnesota. And I'm really grateful for that. She was getting ready to retire as the director of HIM here at Grand Itasca in my hometown. And she was recruiting me to come home, take over for her. She finally convinced me and I came home for an interview in the summer of 2005 and took the job that fall. Elaine immediately plugged me right in to her vast network of connections, including the regional HIM associations, the Scholastica HIM Advisory Committee, the Grand Rapids Area Community Foundation, and just really kind of paved the path for me. And she also did leave me her copy of Edna Huffman's Health Information Management book, which I still have, with some key passages tagged. So I really did love working with Elaine and wanted to give her a little shout out in my presentation. So when I moved back to town, I worked in the old Itasca Medical Center where I was born. And just for a few short months before we moved into our current building in December of that same year. Moving into the new and closing down the old brought many great experiences for me as well, which I didn't really appreciate until much later in my career. And I stayed at Grand Itasca just for a few years and made the decision to move to the Metro. And sorry, my screen went black. Can you guys see my presentation still?
Yes, we can.
Great. Okay. So anyways, I moved to the Metro and I was working at Alina. I was only there for 2 short years, but those years were really packed with great projects and even better people. I met Steph there and Danica, many others. And Steph got me involved in our Minnesota State Association and really, again, just met a broader network of great people, friends and colleagues for life, lots of great laughs and so many learnings. Steph and I share a birthday, so we had an instant connection. And Steph was the person who really made me reflect on my ability to build relationships and how that was affecting my career path. And one time she said, "You just have a way about you. You should explain that to people and how you intertwine that relationship into your work." And so I always think about that now as I get asked frequently about my leadership style and talk about relationships as a big part of that. So it was hard to leave Alina, but I did, and I moved back up to Grand Rapids. There was a new CEO up here, and he convinced me to move back up in 2010 and resume my HIM director role. And that CEO was Mike Yuso, who you see on the slide here. And it was Mike who really taught me that I didn't have to be an expert in all aspects of every department that I'm leading in order to be a good leader. His philosophy was that if you can lead people, you can learn any technical skill. And as he promoted me into different roles, he really had my back as staff, including some physicians. At one point questioned, how can I lead the clinic if I wasn't a nurse, or radiology without ever having taken an x-ray? And I don't think I ever would have envisioned myself moving into this CEO role without the opportunities that Mike presented me with and convinced me that I could handle. So I really wanted to talk about him a little bit. He also convinced me to get my MBA, which I did in 2013. But back to 2010, I moved back home again, and my desk in the HIM department was just as I had left it, with a letter I wrote to the next HIMer 2 years ago typed up. It was neatly on my desk. And for those of you who know me, you know my desk was not neat at all. But it was really just sitting right there waiting for me. And working in the town that I grew up in, it really has been special for me. I always say that it's the best part of my job. Everything we work on has a little more meaning when you know that the patients are your friends, your family, your neighbors. It can certainly also be the hardest part of my job, just being in a small town. I have had many difficult conversations in the grocery store, at the arena, for example, because overall you're just more accessible to people and to patients, to staff. But I really do love that. I love that patients feel like they can be heard and that staff know that I have an open door. Even if they threaten to call my dad if I don't return their calls. I tried really hard to find a picture of my 4th grade teacher for my slide deck, but I was unable to. But during the pandemic last fall, I received a phone call on my cell at home one evening. And I said, hello. And she said, Jeannie, this is your 4th grade teacher, Mrs. Nelson. And I immediately stood up straight and thought, okay, I'm going to take this conversation in. And that consisted of Mrs. Nelson ripping me a new one about our COVID visitor restrictions because her husband unfortunately was in the hospital and she needed to be with him. And after a slight ping of annoyance, I thought about how great it was that she could call up one of her old students and advocate for herself and her husband. And I figured out a way to get her into the hospital. And I changed her name to protect the innocent. But just really wanted to make the point that, living in the town where I grew up, it's really the best and worst part of my job, but really it is my favorite part of the job. So as I think about community and how that plays into what I do every day as a leader, as I moved up the ranks and got promoted to interim CEO, one of the first changes I made was to add a community focus to our senior leadership team. Our foundation director, our marketing and community relations team is just very stellar and very focused on community. And a few members of that original team are here in the photo. And this team's perspective is really unique and really puts a different spin on the way that our healthcare leaders think and the decision-making process at an executive level that I really find very useful, especially in a small town. So, it brings community focus. They think of our community partners and how a decision we're making might affect them, how they might react to it, and just remind us how important it is for us to be out in the community doing our part. The team is really creative. They've developed cool programs called Doc Talk, Walk with a Doc, Shop with a Doc, and several others that pre-pandemic were very popular. So I think coming up through an organization, there's a lot of pluses and minuses, but one of the pluses for me was definitely that I know the history, and I really came in with an idea on where we might be falling short on community engagement. And it's really fun to be in a position to make positive change in that arena. We've tried to get the medical staff to focus on community by changing our physician compensation model. At the end of last year, we made a commitment to implement a community and volunteer focused bonus into the program, which would require medical staff to get out in the community and report that activity back to us. And that does affect their compensation. So the pandemic threw a little bit of a wrench into that because you couldn't really get out and about into the community much over the last year. But when this thing is over, I know that's a hopeful statement, if this thing ever slows down, we will make community involvement and volunteering a requirement along with quality scores for our medical staff. And these things are already established over in the Hibbing department. We also have committed our leadership team to do monthly volunteering at the local food shelf and encourage them to participate in community and Grand Itasca sponsored events if they're able to. Community to me has been really a priority, and it's really everything to me, whether it is our work family, our home family, or the market area we serve. We care about it and we include that in our decision-making process. So I can't really get through this presentation without talking about leadership through the pandemic, which really could be its own presentation, I think. I was awarded this CEO position at Grand Itasca in August of 19, and then in March of 20, of course, the pandemic hit. So these last 2 years have definitely been the most difficult of my career. And I've had to really stretch myself into uncomfortable territory to get through it. And I'm so thankful for the relationships and the trust that developed with the staff and team over the years as we continue to work through this unique and stressful time in healthcare. And even with that as a base, it's been hard to keep morale up and meet the needs of staff and patients and keep operations moving along. I've been reminded of how meaningful that is as I finished my first year in this shared CEO position over in Hibbing. Stepping in as a new leader in a different hospital has really shown me that it isn't as easy to build those relationships when you enter in at a higher level during a crisis. Coming up through the various roles and working side by side with the medical staff and the team at Grand Itasca really made leadership at a higher level feel easy. And I'm still working on figuring out how to develop that same culture in my new environment, starting with baby steps, and hopefully I'll be able to accomplish that. And if I do, I'll have to come back with more stories. I'm sure there'll be plenty. So leading the team through the pandemic is obviously uncharted territory, and I hope I don't have to dust these skills off for some future pandemic, but if I do, I'll be ready. Being in a rural community through this global crisis has been both rewarding and challenging. It was really phenomenal to experience the coming together of our community last year when we were all trying to navigate this virus and keep our patients and staff informed. There were competitive barriers that just dropped, and we were sharing information with our competitors, just trying to find solutions for the good of shared patients and for all of our staff. We were doing lots of communicating, daily, weekly, and monthly press briefings, keeping everyone informed on the ever-changing protocols, what's open, what's canceled, what are the rules around masking, where can you get tested, who can get tested, and then of course vaccine distribution, which felt a little bit like the Hunger Games. We also did daily employee forums for a while and then slowed them down to 3 times per week and then once per week, and now we're doing them every other month. Really just communication and transparency is our goal, trying to make sure that staff are heard and have a chance to ask questions. Our senior team stayed on site and tried to be present with the frontline staff as much as possible. We did not feel good about working from home to keep safe when our staff were out there caring for the community on the front lines. And I think that went a long way. It was this positive culture that helped us to flex and pivot easily as we had to change schedules, change patient flows, implement new policies, and just get through that first year of the pandemic. So it was great to have a little reprieve over the summer, and just when we started getting used to that, the Delta variant started creeping up to our neck of the woods. And we started ringing the alarm bells, of course, but without the mask mandates and stay-at-home orders coming from the government, it was really interesting to see how many were just not willing to take that heat on themselves and make these type of decisions to require masks, for example. We started begging the school districts to mask proactively, and we implemented vaccine mandates, which could be a whole nother presentation. And we did take a lot of heat. There were protests, there were many voicemails and emails. Someone told me to eat poop and others called me a Nazi. To say it was a learning experience would be an understatement. But I really did learn so much about myself this fall. I really could not handle the unrest in the community. So I have done a lot of reflecting. As I've already said, community means so much to me. And, you know, when they kind of turn on you, it was hard to handle. So I had to remove myself from social media for a couple months, and I was disappointed that I was having such a hard time handling it. But in the end, of course, I rallied, and I'm still in that phase right now, and just told myself and my team, we just have to focus on the people and do what we do every day, take care of the community when they need us, whether they're masked or vaccinated or not, and focus on little morale boosters. Get back to the basics again, be present, talk to people, listen. And most of you work in healthcare, so you know we're in a dark time. Nurses are hard to find. We have doctors that are cracking. And we're caring for patients who need services at a higher level, and we just can't get them anywhere. So it is very hard. And if you work in healthcare, thank you for your service. We appreciate you and know how hard it really has been. So I know this picture does not fit my pandemic story, but guess what? I do not have any pictures of the pandemic. So I thought I'd just throw this one in of myself and our VPMA. This was on Ugly Sweater Day last year during Christmas. So on a lighter note, I don't know if any of you have taken the insights assessment to find out what your color is. It's basically a kind of a Myers-Briggs like personality and leadership style tester. There are 4 colors, and I'm a yellow, which means I like to have fun at work. I like to be involved, and I like to document when we all show up randomly wearing the same colors. I promote PC Halloween costumes, and I try not to take myself too seriously. Yellow is pretty rare in healthcare leadership. I think most leaders in healthcare are green, which is the color for the caring folks. I'm turning more green each time I take the insights test. I think it's the pandemic, but my yellow is still on top. So in case you're wondering, there are only 2 other colors. There's the detailed blue for the financial types, and the red, who wants you to be brief, be bright, and be gone. I hope I never lose my yellow, because I do believe it makes me unique in the industry and helps keep everybody laughing and having fun at work. These are all my coworkers, just a few of the same color days that just randomly appear. So I just wanted to talk for a few minutes about my family. This is my daughter, Lizzie. I love this picture of her last year for Halloween. Makes me want to stay strong and get through these pandemic and tough times. I added the slightly inappropriate bath time photo because I just had to share that when I walked in and saw what was happening here. I asked her what was going on and with her Barbies and her mermaids, and she said, "Duh, Mom, they're social distancing 6 feet." And so kind of sad, but also kind of funny. And this is the rest of my family here, the group that keeps me grounded and keeps the household running. Lizzie would be really upset that I cut our dog out of that first picture there. The last picture is of my mom with Lizzie, and I had to throw her in there because honestly, I don't know how I would get through the days without her helping me. She picks up the kids and runs errands for me and everything else. So just really thankful for this crew, and also to my sister who didn't make the photo cut. But family has definitely become my lifeline, and it's amazing how little time I have left over after work and family stuff. And I think what they say about it being a little bit lonely at the top can be especially true in a small town, especially one where the hospital is the largest employer. Nobody really wants to hang out with the boss. As I already mentioned, I learned my lessons that back in 1998, that your behavior really does reflect on yourself as a person and also your organization. So it's a good thing I have this big family and the 6-year-old keeping me busy. So I wanted to add a little more to my presentation about women in leadership and how my views on this have really changed since I stepped into the CEO role. And that again could probably be its own topic too, but I've really been trying to reflect on how important it is to be a woman in this role. And I am the first woman CEO at Grand Itasca, but that's not true at Range. I think I'm the third one over there, which is great. And I never really thought about it too much, to be honest, outside of everyone thinking I'm a nurse when I say I work at the hospital. But when I took this role, I really started to receive a lot of comments, and I got a lot of note cards in the mail saying, thank you for being a role model. And it really kind of put the pressure on, to be a role model for young women. And I really hope to do more work in that regard, as I get a little further into my career and focus on women in leadership. I could, talk about the support that my current boss at Fairview, Laura Reed, has given me, as well as my current leadership team. To sum up kind of my presentation today, I wanted to just share some feedback that I received last year as I took on my new role. The CEO of Fairview told me that people don't often notice leadership because good leadership doesn't scream, "Look at me," but it really focuses on the organization and its people, helping them to be successful. And when they do when they do recognize that success, they say, "Look at what we did together." And those words really hit home for me, really explain kind of in simple terms my leadership style and philosophy around that. And of course, I get the rest of my philosophy from my Dove chocolates. And this is one of my favorite sayings here: your vibe attracts your tribe. So I feel like I went really fast, but that's good because we can have a lot of time for discussion or questions. I hope you guys found my story interesting, and just want to thank you again for joining us, and happy to open it up.
Just a reminder, if you have any questions, just feel free to either unmute yourself and ask your question. And if it gets too unruly, we can do the raise hand feature, or feel free to reuse the raise hand feature. Or that way. Why don't I start things off? Jean, you have been in a leadership role in a number of different ways. In your leadership role as a leader for a healthcare organization, can you speak to how your philosophy from, a leader with like the Minnesota Health Information Management Association, was that experience, do you feel like that experience, something like that, helped prepare you for a leader in a much different type of environment? What was the commonalities or that helped prepare you for your role you are in now?
Yeah, it's a good question, and then one that I've thought about a little bit. I think that, what's interesting is you get through school and then figure out, how to apply what you learned into the real world. I talked a little bit about trying to focus on the basics, being good at the computer and trying to make up for what you don't know with the basics. I do think, participating in and leading some of the local association meetings, it really did help me, in figuring out how to run a meeting, and kind of provided a safe space to learn the Roberts rules, which I didn't even know what those were until I was about halfway through. But, it kind of gives you a safe place to try that out and figure out, how to make motions and what the appropriate protocols are for people to discuss and ask questions. And that certainly, has helped me not only running meetings at work and leading discussions in that way, but also out in the community when I sit on a board of directors or do anything else. And actually, as I mentor people now, it's funny how many people feel really uncomfortable with that. Just saying, does anyone have a motion, and is there a second, or when do you say, is it time for discussion? So I think that has been really helpful. And of course, just getting to know the people and networking and making all of those connections, that has been really important for me.
Great. There are a couple questions in the chat. The first is, what advice would you give someone wanting to be a director or CEO of a rural healthcare facility?
Sure. I think just getting yourself out there and gaining as much experience as you can. I was really thankful that I worked through my college experience and, started out small in leadership, tried to take on small management positions that would eventually kind of grow you into something different, and not to pigeonhole yourself. I think in my 23 years in healthcare, I've heard almost every year, how do HIMers branch out, or how do you get HIM to the table? And I know things have changed a lot since I went to school, because HIM is so much broader now. But I think I would advise people not to set your sights too small, because the skills that you have are really applicable to a lot of areas in healthcare. And I really do agree with what Mike taught me about being a leader. And I know it now as I go through hiring leaders, that if someone is a good leader, you can figure out how to lead a department, even if you don't like the business office or whatever that you've never worked in, because you can learn the functionality and the technical side of it. It's that leadership skill that's so important.
Thank you. Another question, from your experiences, what skill would you have liked to learn or know about sooner to help in your career?
Yeah, I just got asked this this week. I think I did an interview with a couple of Scholastica students via Zoom, and they asked me this question, and I said right away that I wished I would have had more project management learnings and experience. And they said, oh, we learned that now. That's really ingrained in our program, which I know is true. But for me, I don't feel like I came out with that, because it just wasn't a big focus. But I do think that my career path was really affected by projects. I was given a lot of projects to lead, and if you do one successfully, then you get asked to do another one. And I did have, the first one I did was an EHR project here in Grand Itasca, And so definitely HIM focused, but that was starting just as I was coming back the second time, and the project manager was exiting the organization. So I kind of jumped right into that one. And I felt like it was in my wheelhouse. But after that, I did I led a retail pharmacy project and a couple of construction projects for the facility, and kind of scary, but just, knowing again how to lead through that type of project, even if you don't know exactly all of the technical aspects. You have to know that you don't know everything and know who to talk to, and keep the team around you to support you.
What is some of the major challenges that you anticipate rural healthcare will face over the course of the next decade?
Sure. I think right now, the biggest challenge that we're going to face and that we are facing is workforce development and recruitment and retention. I think this pandemic has changed our industry, and it's certainly made us look at the way that our staff are faring, and we've seen people leave healthcare altogether, which I think is sad to see, but understandable. It's been a rough couple of years, and I think we're going to see more of that. People will be looking at other professions, and we need to make sure we have programs coming up with the staff that we're going to need to support our rural facilities. It's interesting, through the pandemic, at Grand Itasca, we hired, I think, 7 or 8 physicians, and in Hibbing we hired 9. And those are just crazy numbers. We don't hire physicians like that here, but for the first time ever, we saw a lot of physicians wanting to get out of the metro and move to the rural. And I don't know if that will last, how long that will last, but really felt fortunate to see that. But going forward, I don't expect that to be the trend. I'm worried about nurses. We have more nursing positions open here than we have students in programs. And so just finding the people we need to do the jobs and keep our beds open is what I worry about.
Great, thank you. Another question is, this comes from Tracy. So I'm speaking as though I'm speaking from Tracy, okay? I work in a small rural hospital on Long Island, New York. How have you helped patients transition to seeing the hospital as a place rather to hang out, but more of a remote experience, knowing that patients all have different comfort levels with technology?
Sure. So we've really dealt a lot with this, of course, over the last couple of years with the pandemic. We've had to convince our community to use virtual visits, and we have a large senior population in both of our communities up here, and limited access to broadband in some cases. So using telehealth and virtual visits was not exactly easy for all of our patients. But it was actually really surprising how quickly our patients and our community transitioned to that. And I think obviously just the pandemic and the kind of the fear and the need that they had to see their providers, knowing that at one point was the only way to do it. People just figured it out and figured out how to either call in for a phone visit or do a virtual visit. But I'll tell you, the minute we offered in-person visits last year, I would say 95% of our patients would come in with their masks. They much preferred that to using the virtual options. But being part of a larger health system, so we're both part of mHealth Fairview up here, we've had the opportunity to implement several telehealth options for our patients, including, cardiology visits. We have telestroke in the ER. We have behavioral health assessments in our ER. They're all done virtually. And so we are kind of dipping our toes into that, and that too has gone pretty well for our patients. So I think that is one of the silver linings from the pandemic, that we're able to push a lot of our virtual and tele programming through with little to no pushback because that was just the only option.
I think I'm unmuted if you can
Yeah.
hear me. This is Tracy. Yeah. So yeah, I work out in Southampton Hospital, Long Island. So it's small community. We're the only hospital in like 50-mile radius. So, it's not rural, like in other parts of the country, but really rural for our neck of the woods. And, like what I'm working with moving my operations staff to partial remote, which they're thrilled with. It's definitely a, retention. The coders were sent home when the hospitalist took over the second floor of our office. And, part of it is struggling with the customer service aspect, which that, rang true with me in your story. It's just like moving patients to, it's where they come to pick up records to like see people, you know what I mean?
Right.
Where it's like, if you're trying to move remote, it's like, we want to help you. We'll get your records as fast as we can. We do a pretty good job of, like almost 24-hour turnaround time with, like patient, like access requests, which is, like definitely responsive, but it's like moving them to, like a remote environment, which allows then, like the staff to be remote. And I think I saw one of the questions for recruiting, like HIM, like staff is definitely having the either, fully remote or partial remote, like opportunity for the, operations side in the HIM department. So, but it's our, patients, and sometimes it's like, do we spoil them? And like, they're never gonna, that they just want to come, sometimes just to hang out. It's like, no, there's another way of doing it. So.
Right. Yeah. And I'm sorry, I thought you meant patients virtually, but
No, that's okay.
Yeah. No, we have experienced that as well. And, it's interesting. And right now we're finding with this workforce development and retention issue that we're all facing, we're competing in rural areas now with metro facilities because our employees our support staff, like our business office, our HIMers, they can work here
remote.
and live here and work for the metro facilities and make more money. So it really changes everything about our wage scales and how we benchmark our how we do everything. So we're sort of right in the middle of that right now, but through the pandemic, what I said about the patients using virtual technology is true for the staff too. When we had to furlough staff last year, we did eventually convert many of them to at-home workers, and a lot of that is still in place now and will stay because it's working and it's frees up space in the facility, and it's kind of a win-win.
Yeah. Thank you.
Sure.
Jean, there's another question here. Do you see evolving roles for HIM professionals? How do we build and encourage leadership roles when so many are moving to analytics and informatics roles?
Sure. And hi, Steph. This one is tough because I think people are doing, I think leadership gets a little bit of a bad rap. So, it's important to encourage people to become leaders, and especially in rural areas, we try to find those analytics and informatics folks and find the ones that we think we can grow into leaders, because if you don't start out in a leadership role, I think it's hard to take that leap. But for HIM, I think the progression through project management and then into leadership, which I think I've kind of said already, but I think that is a really easy path for people to kind of test out a leadership role, even if it's just kind of leading a smaller project within a department. I think it's up to us as leaders to figure out how to grow leaders within in rural settings, especially because recruiting leadership talent in our hospitals here, I think it's harder than recruiting physicians. And leadership it's just hard to find out there. So yeah, I think it's sort of like physicians. We have a lot of them specializing now, and family practice is the hardest recruit for rural medicine. And that's what we're seeing too in our industry. People are focusing on analytics and data, and not as much on the traditional roles, which when I went to school, it was everybody was focusing on HIM director, leadership, and, you know, those alternative roles are now sort of the norm. I don't know if I gave any good ideas there, but kind of rambling.
How are you able to attract prospective employees and staff to work in a rural setting?
Sure. So I feel like the communities kind of sell their self up here a little bit, but it is really difficult to retain recruits in leadership or medical staff unless you can find a tie to the community or some sort of connection. So we've had a lot of misses with recruiting in all positions. You know, we live in rural Minnesota, so if you don't like the winter, this is not going to work for you. If you love the outdoors and want to fish and cross-country ski, I think it's just a simple sell. And we do have good connections with our community, and our team here really does an awesome job of you know, doing community tours and connecting people in with what they want to do, or, you know, school tours, or showing them the Rife Center or the dance program for their kids, whatever the connections are that they need to see. But it is just a reality that, you know, if someone's looking for easy access to an airport, then this is not going to be the place for them. If they want to travel every weekend, it's going to be hard, you know, because there's not an airport here in town that can get them to Minneapolis quickly. So it is a different sell, but I think that makes the recruiting a little bit different, the way that we recruit and explain our area. You know, you have to be really specific to reach the right person.
Jean, I have a question. How do you overcome as a leader that employees speaking of management or administration as though they're like swear words, curse words, that the us versus them mentality? How do you overcome that and cultivate more of a collaborative environment between employees and the management?
Yeah, this is really relevant right now. I think, you know, I can think of a lot of examples where this is happening. You know, for me personally, I'm a get out there and talk to people kind of a leader. And so, you know, if I hear that in an email, or if somebody says that to me, I'm not afraid to just go find them and sit down and just, you know, listen. And usually that administration made us do it kind of a mentality is a tough one. And for the leadership team, I try to make sure that we're all out there. You know, we do required rounding each week, so it forces us to get out and talk to staff. And I feel like that helps to kind of curb a little bit of that us versus them. I think the union environments make that a little bit more difficult. And, you know, it's a little bit harder sometimes to break through to the unions and the union staff when we get into that kind of back and forth. But to me, it's all about communication and just sitting down and talking to people, participating in the discussion, and not just sitting in the office sending emails back and forth, because that's never going to solve the problem, in my opinion.
Kind of related to that, and you made a comment during your talk about the feeling of isolation as at the highest level. How do you maintain your own sanity being in that level? Like, what do you do? You know, we have a lot of students, a lot of emerging professionals that aspire to be at the top, but I think there's this unexpected consequence of it, and you got to balance it somehow. So what advice would you give them to manage all of that?
Yeah, and I hope I didn't make it sound so horrible, but it is just growing up here. I mean, I think I have a large friend circle, but I don't really go anywhere except the arena to watch my daughter play hockey, and from the hospitals and home to the grocery store. You know, I'm just tired. This pandemic's been crazy. So I feel kind of relieved that there's not much else to do socially right now, because we all need the rest. But, you know, in general, I think you got to put yourself out there a little bit, and I could be better at that. I think it's easy in these kind of tough times to retreat in and just, you know, I can send my husband out to do errands, so I don't have to have those tough conversations, but that's not really my style. You know, I think you have to find your friend circle that can separate out the leadership stuff and the role, you know, and not really care about what you do for a living or what position you're in. And of course, I do have friends like that. And the network that I talked about, you know, that I've built through my connections in the metro and through the Mahima Association, you know, there's always people to call on. And of course, you have to do that. You have to find people you can talk to and bounce ideas off of, or just vent. And for me, I mean, my coworkers, we all spend more time at work than we do at home. And I really do find my work family to be a family, and we rely on each other a lot too, especially right now. And, you know, I feel like I have two worlds going on, the pandemic world and everything pre-pandemic. So it feels a little bit different now, like we're all in survival mode.
Okay, I have a fun question.
Sure.
If you could have anything to help you with your job, or to help in rural healthcare, whatever, you can approach this however you want. But if you could have one thing, no concern over cost, no concern over any of the limiting factors, what would that one thing be?
Gosh. I think pre-pandemic, I would have said an endless pot of money to, like, you know, fix things and implement programming. But now I think I would say an endless pool of people who are skilled that can step in and help. And, you know, I wish that we could do more. I wish we could do more here for our staff, just to support and get through the days. And again, there's probably the pre-pandemic answer is probably more fun. Right now, I feel like in survival mode, the answer is really just wish we could have more nurses, more lab staff, more of everybody.
Yes, I think that is felt in everywhere as well, with just needing people. Where are you people? Come on. Are there any other questions? I want to make sure if others have a chance to ask questions. Remember, please feel free to type in your questions into the chat, or you can unmute yourself and ask your question that way. There is a question that came up. The roles of health informatics and information management professionals are constantly evolving. What recommendations do you have for those looking for new opportunities when they don't feel they meet all of the requirements of the position?
Sure. I think talking, you know, if you're in a role and you feel like you want to try something new, but you don't meet the quals, I would find that hiring manager and talk to them about what your aspirations are, and you know, talk to them about how you might get there if the qualifications are a hard stop. You know, if you need 10 years experience and you only have 5, or if you need something else that you don't have. I do think that leaders, especially nowadays, are a little more flexible with that type of qualification. You know, leadership skills are, people might be more willing to hire, and if you show the initiative to you know, approach a leader with questions and ask how could I get there, what could I do to make myself qualified for this position, just show that initiative. I think that that would go a long way with leaders.
Can you speak a little bit about mentorship and how that? I mean, you show a lot of pictures of you know, the people that have served as mentors, and what would you say to people, like, in terms of how do you find a mentor? What's the value of that? And what advice would you give someone that's seeking something like that out?
Yeah, I think for me, I found sort of casual mentors, so I didn't necessarily formally say, you know, Elaine, will you be my mentor? Just sort of in working together, you find a lot of value in the experience and take a lot of things away from it and learnings. But I do have leaders who have said to me, I really think I could benefit from talking to someone. Everybody uses the term coach, like a professional coach now, or a mentor, and I really encourage that. We have several staff here who will, again, the benefit of being connected to a system too. You could call there and just say, could we meet once a month? Could you give me some feedback about, this, that, or whatever? I found in the community, as I sit on some community boards, I have two right now, two folks that I meet with on a monthly basis after the board meetings, because they just want to talk about, the process of the board meetings. And one of them is really nervous to speak up in public, so he's been trying to figure out how to be better at that, and he asked me to kind of coach him after each board meeting to give some feedback. And I think that kind of, again, initiative to reach out and to ask for that kind of connection is pretty neat. And sometimes it just happens organically. Like I was saying, you might work with someone for 5 years and think, wow, I really learned a lot from that person, and it was more informal. But I definitely think there are ways to set that up for yourself too, if you don't have that experience in your day-to-day.
Who are in terms of community outreach, who are the parties or organizations that you need to interact with the most in your role?
Yeah, I mean, right now it's definitely public health. We interact with the public health departments quite a bit. We interact with the school districts, local school districts, the county, all of our assisted livings and kind of long-term care facilities that are not part of our organization, but certainly part of the healthcare community. We really have been reaching out to each other a lot through the pandemic. So that feels like, again, that it's going on a long time. And we've really been connecting on a regular basis since the start of it. Otherwise,
very good.
I would say, we have connections with our economic development association in town. Both Fairview Range and Grand Itasca are the largest employers in each of the communities. So we are included in a lot of initiatives that happen in the community as far as workforce development, or they ask us to come into the school and talk to the kids, or do stuff like that.
Thank you. Are there other questions for Jean? Remember, you can unmute yourself to ask your questions.
I have one.
Type them in. Yes, go ahead.
So hi, Jean, thanks for coming to chat with us. My question is, with so much of the workforce, especially with the pandemic and potentially moving forward for HIMers and other similar positions, how do you what's the best way that you found to help build morale and team building being in a virtual environment or that remote environment?
Yeah. It's been this Zoom and Teams phenomenon has been kind of a lifesaver through the pandemic. And actually for me personally, as I do this shared role, because I can stay connected. But I do think it's also really terrible because socially we're all removed, and we're not able to get in the same room, which I really enjoy. And I enjoy getting out there and talking to people face to face. So I do think with morale, employees are fatigued with all of it. And we've tried to do a lot of regular morale boosters for our staff. We've had to cancel all of our employee recognition events, and haven't been able to do our employee picnics. So we've been trying to find ways to do just other small things to show the staff that they're appreciated. And that might just be, handing out coffee at the employee entrance, or, instead of our picnic, we handed out some pizza certificates, and just little things to try to keep the staff, put a smile on their face. And, the one thing I would say though, that's the most meaningful is that rounding. And it's so easy to get sucked into these Teams meetings all day. I think I could do it from 8 to 5 if I let my calendar get that way. So I think it's really important to be meaningful about blocking out your calendar to get out and about and just talk to staff, even if you're just checking in, how's it going? Especially now more than ever, I think they want to see leadership, and it really means a lot just to do a quick check-in and give them a chance to vent or ask questions or whatever they need.
Another question in the chat. How is your facility dealing with any concerns related to social determinants of health and the well-being of your rural community?
Yeah, we just are finishing up our community health needs assessment, and this is always a hot topic, and there's lots of good programming in our community, which I'm thankful for. We have a lot of mental health first aid classes that are happening. Lots of conversations around transportation and just basic access to care. We've tried to kind of improve access to care in both of our communities by spreading ourselves out a little bit and, making sure that folks have transportation to and from the facility if they need it, working with the city on some projects around transportation. So, I don't have a great answer, but that is something that we talk about and that we look at. And like I said, both facilities just did the community health needs assessment, and we've been focusing on ways to make sure that our communities have the access to care that they need.
Thank you. Other questions from the audience? And let me check the chat here. Hang on. All right. Any other questions from anyone? Jean, are there any last remarks or comments you want to make with regards to rural health leadership and your journey, and any advice you'd like to give emerging professionals or even those that have been in their role for a very long time?
Sure. Yeah, I just like to say thank you again for having me, and it's interesting to look at your own career and try to figure out how the heck you got to the place where you are. And it is pretty surprising for me. I really can't express enough how important it is not to just stay stuck in one spot unless that's where you want to be. Branch out, try new things, and don't be afraid to reach out and talk to other leaders. I love to do that if anybody wants to reach out and talk to me. And I think that's what I would leave you with. So thanks again. And Kathy, nice to see you there.
Well, thank you so
Good to
much,
see you,
Jean.
Jean.
On behalf of all of us at the College of St. Scholastica and within the Department of Health Informatics and Information Management, thank you for those of you who have attended. Jean, thank you so much for sharing your insights and your journey with us today. And we just want to wish all of you a very safe and happy holiday season. Thank you for spending your evening with us.
Thank you all.
Thank you.
Thank you so much.
Thank you.
Thank you.
Bye.
Bye.